All right, hello. So my name's Nicole Bachynski. You almost got it right.
Almost.
Yeah. I am in Regina, Saskatchewan. So Lisa talked a little bit about where we are. So I'm in the southern portion of the province, where we have some of the highest HIV rate in the country. Saskatchewan has twice that of the national average, and our HIV is different. We have high rates of IV drug use amongst those who are positive, and an overrepresentation of Aboriginal people. And women, there's more women than men who are positive, which is different than the rest of Canada, particularly women who are of childbearing age. So what's the province doing about it? We have the Saskatchewan HIV strategy, which was created to reduce the number of new HIV infections, reduce the risk for acquisition of HIV infections, and to improve the quality of life for people living with HIV. The community engagement and education pillar is what the peer program falls under. So the peer-to-peer program is a pilot project that started up last spring. We have money until the end of this year. We've got our fingers crossed that we have additional funding. Base funding would even be better. But we're still trucking along and moving forward, really hoping that things will work out. So we really believe that no one understands what it's like to live with HIV other than somebody else who's living with it. The program has HIV-positive peer mentors, which support HIV-positive peers. There are currently about 8 peer mentors in the program, all at kind of varying levels of involvement. They have to apply, are interviewed, have criminal record checks, and then they attend various training sessions and then monthly team meetings, and then I provide ongoing support. I'm kind of in the background of things. And we really look for people, for mentors who are empathetic, they're accepting, they're genuine, they really want to help others and are quite stable in their own personal lives. So the goal of the program is really to increase engagement and retention in healthcare of individuals living with HIV, increasing the likelihood that they stay connected to a healthcare provider. Most of the referrals come from the infectious disease clinic at the Regina General Hospital. They usually call me or send me a message, that kind of thing, or else from the public health office, of which I'm housed out of, and most of those referrals tend to be people who are newly diagnosed, where from the ID clinic, most of those people are the difficult to engage people. So once I receive that referral, I contact the person, we get together, it's pretty informal for the most part, I go over the program, I obtain their consent at that meeting, we get to know each other a little bit, because right after that, I facilitate a meeting between the peer mentor, the peer mentee, and myself. And at that meeting, the mentor and the mentee, they complete a confidentiality agreement between the two, and the peer talks about what they want out of a peer mentor. So from there, I'm available always for support and help if needed, but it's really about what the peer wants. So sometimes all that is they're going out for coffee, that mentor is a pair of ears, they just want somebody who can relate, having that lived experience. And they walk with them in their journey. They don't walk ahead, they don't walk behind, they really walk with them. And they help navigate the system. Healthcare system can be very overwhelming and confusing, so our mentors help them along. We have many successes. We're new, but we have over 30 referrals, and we've had over 20 matches. One of the peers recently graduated into a mentor herself, which is very exciting. And of course, there's challenges, one being difficult. It's difficult for me to, I have 0 minutes left. It's difficult for me to engage with those hard to reach people. So one way that we're hoping that gap will be bridged is peer mentors are going to start being at the primary care facility on HIV clinic days so that they'll be available to meet with peers. So I think I'm done now. So I have my emails there and phone number. You feel free to send me a message or give me a call.